Okay. Well, again, thank you all for being here tonight. I wanted to introduce our speakers for this topic. Our first speaker is Erica Ramirez, and she is the Health Navigation Program Manager for Northwest Family Services. Erica is also part of the Pink Lemonade Project Programs Committee. So thank you so much, Erica. And then also we have Caitlin Kakachi, excuse me, Managed Care Regional Coordinator for CMAR Community Health Centers. And we're so excited to have you with us as well today. And we'll go ahead and have Erica start. And I am going to share my screen and we'll get the presentation going. And just one second. Hard to see both things at the same time. My screen is being a little funny. Here we go. Okay, Erica, I will mute myself and.
Okay. Good afternoon, everyone. My name is Erica Ramirez, and I will be talking about navigating healthcare after breast cancer diagnosis. Just to talk about how we help patients that we navigate through the healthcare system when they go get their mammogram done, and if they get diagnosed with breast cancer, how we have different programs that we're able to offer to help them through the process. Next slide. Sorry, I'm trying to fix my screen so that I can see. Okay, so first I just want to say what healthcare navigation is. A healthcare navigation after breast cancer refers to the process of effectively managing and accessing medical services and support following a breast cancer diagnosis. It involves understanding the healthcare system, overcoming barriers, making informed decisions, and seeking the necessary care and resources to address one's physical, emotional, and psychological needs during and after a breast cancer treatment. Next slide. And then I just wanted to add a little bit about understanding breast cancer. I know you went ahead, Talia. Okay. So no matter who you are, where you live, breast cancer may touch your life. And then breast cancer, so in a healthy body, natural systems control certain growth and death of cells. Cancer occurs when these symptoms don't work right. When cells don't die at a normal rate, there's more cell growth than there is cell death. This excess growth can form a tumor. Breast cancer occurs when cells in the breast divide and grow without their normal control. Tumors in the breast tend to grow slowly. By the time a lump is large enough to feel, it may have been growing for as long as 10 years. Some tumors are aggressive and grow much faster. About 80% of cancers begin in the milk ducts, about 10% begin in the luvules, and fewer begin in other breast tissue. Next slide. Breast cancer screening and early detection play an important role in your health. Screening tests can help detect breast cancer at an early stage when the chances of survival are highest. Whether you're ready to get your first screening mammogram or want to know more about follow-up tests after an abnormal finding, learning about breast cancer screening tests and the importance of early breast cancer detection can help take charge of your health. Next slide. So we help a lot of people in the underserved communities. And some of the challenges that they face are limit access to health care, lack of health insurance, language barriers, fear of deportation, cultural stigma, limited awareness and education, transportation and logistics, limited trust in the healthcare system, financial constraints, and access to support services. Individuals often do not have health insurance, which can deter them from seeking routine breast cancer screening, such as mammograms, or obtaining necessary treatments due to the high cost. Language can be a significant barrier, as individuals may not be proficient in the local language, making it difficult to communicate with healthcare providers and understanding medical information. Next. Some may have mistrust in the healthcare system due to past discrimination or disparities in care, which can impact their willingness to seek help. Many individuals may face challenges related to transportation to healthcare facilities or childcare responsibilities, making it difficult to attend appointments. Addressing these challenges requires a multi-phase approach, including community outreach, cultural sensitivity, healthcare services, education, access to affordable care, and policies that protect individuals' privacy and immigration status when seeking medical attention. Providing information and resource tailored to those communities can help improve breast cancer screening rates and ensure the treatment is accessible and culturally competent. Next, navigating the healthcare system. We offer a range of support services to assist women in our community in navigating the healthcare system effectively. Our program actively connects them with healthcare providers for their well women exam. Once they obtain a referral for a mammogram, we take steps to ensure that they can schedule their appointments seamlessly. Furthermore, we proactively identify and address any barriers that might hinder their ability to attend their appointment, including language barriers and transportation issues. Next slide. In an unfortunate event of a breast cancer diagnosis, our dedicated community health workers step in to facilitate and connect to primary care providers. This initiates the vital treatment process. We achieve this by either facilitating access to our donated services or assisting them and enrolling them in the Healthier Oregon plan, ensuring that this woman receive the necessary care they deserve. If they are approved for the Oregon Health Plan, we provide valuable assistance by thoroughly explaining the extensive benefits accessible to them. Additionally, we readily available to address any inquiries or concerns they may have regarding their access to healthcare services. Next slide. Financial assistance and insurance options. Thanks to the Oregon Health Plan, individuals in Oregon now have the opportunity to apply for Medicaid benefits, regardless of their immigration status. This significant development is particularly noteworthy as it had opened doors to healthcare access for many who previously faced barriers to obtaining the essential care they require. For women who receive a breast cancer diagnosis but do not meet Medicaid income eligibility requirements, an additional resource is available, the Breast and Cervical Cancer Treatment Program. Next slide. These programs serve as a vital avenue to help these individuals gain access to essential cancer treatment services. Several dedicated organizations, including the Oregon Cancer Foundation, Susan G. Komen, Pink Lemonade Project, American Cancer Society, and Breast Friends are committed to providing valuable financial assistance and support to women undergoing breast cancer treatment. Breast cancer diagnosis can invoke strong emotions, including fear and social stigma, which may hinder individuals from seeking timely health care. It is essential to address and connect these concerns and provide support. So understanding fear, knowledge that fear is a natural response to a breast cancer diagnosis, challenging stigma, addressing any cultural or social stigma associated with breast cancer, education and awareness, emphasize the role of education and awareness in dispelling myths and reduce fear. Support groups and counseling. Mention the availability of support groups and counseling services and encourage individuals to seek emotional support from peers who have faced similar challenges. Next slide. Empowerment. Promote self-empowerment and decision-making in the treatment process. Encourage individuals to take an active role in their healthcare decisions, which can help alleviate fear. Cultural sensitivity. Emphasize the importance of culturally sensitive healthcare, where providers understand and respect cultural beliefs and practices. Community awareness campaigns. Highlight ongoing community campaigns aimed to reducing fear and stigma surrounding breast cancer. Positive outcomes. Share stories of individuals who, despite initial fear and stigma, have successfully completed treatment and are leading fulfilling lives. By addressing fear and stigma openly and sensitively, we can help individuals facing breast cancer diagnosis feel more support and empowered to seek the care they need. Next slide. How we help. Our organization offers a comprehensive support network to ensure that individuals diagnosed with breast cancer have access to the treatment they need. Through our dedicated OHP assisters, the Project Access Network program, BCCTP, and the generous donations of services by Kaiser Permanente, we can connect individuals to cost-free cancer treatment. We want to ensure that we are committed to facilitating this vital connection to treatment. In addition to the practical aspect of connecting to care, we recognize the importance of emotional support. That is why we provide information about support groups where individuals can connect with others who have experienced similar journeys. Next slide. And we firmly believe that no one should face a challenge alone. By connecting with others who have gone through or are currently going through similar experiences, individuals can find understanding and empathy, as those who have walked in similar paths are often the most meaningful support. And this page just has a couple of resources that could be helpful. Next slide. And this one just has our contact information. So all four of us are certified community health workers. We've been helping women connect to get their mammogram screening done. And as I mentioned, if they get diagnosed with breast cancer, we connect them to treatment. Any questions?
Thank you, Erica.
Yes,
As
I
you
have
can
a question.
see, go for it.
Sorry. I'm just thinking if this workshop we can offer in other agencies, like, like OCDC maybe, or Adelante Mujeres, or some another is open, right? Okay. Thank you.
And thank you for your patience with the slides. They were not advancing very well. I had to click 2 or 3 times just to advance one. Any other questions? We can save some time at the end for questions as well. But if you have any initial ones right now, that's fine. And if not, then we'll turn it over to Kate. And Kate, you tell me if you would like to have me advance the slides or if you want to share your screen. Might work a little bit smoother if you do, but
Yeah,
if not, no problem.
Let me see again. I apologize. I have not used Zoom. I'm gonna go ahead and let you do it because I have not used Zoom in a very long time.
Oh, that's quite all right. No problem. I'm hoping this next one will be a little bit smoother. We'll see.
Now that Erica went first, I will just take the curve learning, right?
Okay, yeah, no problem. Yeah, so hopefully, can everyone see this okay?
Okay, so first and foremost, I'd like to introduce myself. My name is Kate Sakachi. My pronouns are she, her, and Aya. I work at CMAR Community Health Center, and in that role, I am a regional coordinator for Clark, Cowlitz, Klickitat, Wahkiakum, Skamania, Grays Harbor, and Pacific County. And in those counties, we are contracted with the state of Washington as a lead organization. So next slide, please. So in today's presentation, I'm just going to go over what Washington Apple Health coverage options look like, specifically for today's point of view, which is geared towards the Pink Lemonade Project and breast cancer health awareness. So those are the specific points that I'm going to cover with some variations to just overall coverage options for the state of Washington. Next slide, please. So what is a lead org? So in the state of Washington, we have sections of our state that are regionally dissected into contracted community health centers with the Washington Apple Health Benefit Exchange. So that is the fancy word for Washington Apple Health. So we work directly with the exchange and with their individuals who work with the Navigator program, as well as with contracting and any legislation processes or marketing for specifically Washington Apple Health. So if you see the map that I attached to this slide, the orange is CMAR Community Health Centers, and that is the areas and counties in which we hold lead org. So as a lead org, we have the opportunity to contract with community-based organizations and train them in access to the Navigator program for the Washington Apple Health. In addition to that, CMAR also employs our own navigators. At this point in time, we have 3 regional coordinators, myself who covers the Southwest Washington region. That's going to be your lower half, which includes Grays Harbor down to Cowlitz and Clark County. Then we have a South Regional Coordinator who does Mason, Thurston, and Pierce. And then we have our North Sound Coordinator who does Snohomish, Skagit, and Whatcom. So we are all throughout the state and provide this education not only to our internal employees, but we hold over 25 MOUs with community-based organizations that we help retain access to the Navigator program to enroll individuals who are eligible for coverage. So next slide, please. So in Washington, as well as many other places, open enrollment for Medicaid through the marketplace begins November 1st to December 31st. And then Washington generally offers an extended open enrollment period, which is January 1st to January 15th. So individuals who are able to enroll into a QHP option through November 1st to December 31st have a coverage start date of 1/1 of the enrollment year. And then anyone who is able to enroll January 1st to the 15th has a coverage date starting February 1st of 2024. So obviously there are some caveats to enrollment periods, and we call those special enrollment periods. And generally those are related to qualifying life events. So for those life events that don't qualify, you have to enroll within that open market period, which is November 1st to January 15th in the state of Washington. And then we'll go into special enrollment periods shortly. So next slide, please. So exceptions for open enrollment are qualifying life events. That generally is adding dependent, becoming a dependent, losing dependent status, change of citizenship status or lawful presence, or losing healthcare coverage. So loss of a job, divorce, or loss of Apple Health opens you into a 90-day special enrollment period, and you're able to qualify for Apple Health and or a qualified health plan. Next slide, please. So qualified health plans, if you're not eligible for Washington Apple Health, we do offer what we refer to as a QHP, as well as a QH dental plan in Washington Health Plan Finder. Depending on your monthly income, Washington State does offer not only federal tax credits, but we offer state credits as well. Your income has to be below the 400% of the poverty level to receive those tax credits. And the only eligibility requirements for a QHP is to be a Washington State resident, be below the age of 65, and not be currently incarcerated. Next slide, please. So, qualified health plan. So a qualified health plan is for individuals who apply for Washington Apple Health and they don't meet the federal poverty guideline for Medicaid. Washington State offers a qualified health plan. So they're able to purchase a QHP through the marketplace, and we are able to apply dependent on their document status. We're able to apply not only federal tax credits, but we're able to apply state tax credits, which allow your monthly premium to be more affordable. So in experiences of working on applications, I have seen a monthly QHP be as low as $5 once tax credits are applied. So does that answer your question? Yes, thank you. Next slide, please. So in the state of Washington, we offer AEM. It's coverage for individuals who do not meet that citizenship requirement or the immigration status requirement. In order to be eligible for AEM, you need to meet specific medical emergencies. Qualifying medical emergencies can range from emergency room care, inpatient hospital admission, outpatient hospital surgery, cancer treatment, dialysis treatment, and anti-rejection medication for organ transplant. Next slide, please. So in order to qualify for AEM, you must have a diagnosis that's provided in a hospital setting. Certification is limited to the dates in which those services are provided, with the exception of dialysis and cancer treatments and anti-rejection medication. That does not have to be done in an inpatient setting. There just needs to be a written diagnosis from a healthcare provider. So the qualifying services that can be done outpatient are cancer, acute renal failure, or end of renal disease, and again, the anti-rejection medications. So those can be done in an outpatient setting. Next slide, please. So in order to receive cancer treatment or life-threatening benign tumors at this point in time, before the 2024 start date of coverage, a person needs to be 19 years of age or older, who's not pregnant and meets the eligibility requirements. They need to have this service done in an eligible scope of practice, and the condition needs to require either surgery, chemotherapy, radiation therapy to treat this life-threatening cancer diagnosis or life-threatening benign tumor diagnosis. When related to qualifying medical conditions, the services are included but not limited to that treatment. So specifically for any other medical treatment that might not fall under the scope of coverage. So to be qualified for this, you do have to be diagnosed with a medical provider who is licensed in the state of Washington and or Oregon. And it has to be an established and confirmed diagnosis in order to have the medical coverage kick in. So there needs to be that workup of a presence of cancer or life-threatening tumor. Unfortunately, there is not coverage for the screening and diagnosis of that. You must be actively having the illness. So generally, candidly speaking, a lot of the times these diagnoses crop up when it's already been present, and it's only when they do come, individuals do come into the ER related to some other symptoms that this diagnosis is then identified. But once the diagnosis is identified, the AEM can go for continuing treatment options related to their cancer diagnosis or life-threatening benign tumor. Next slide, please. So the big part of why I'm here today is to specifically talk about a legislation that was recently passed for the state of Washington, which is a huge step forward for us. And it's that in December of 2022, the CMS approved the 1332 waiver in the state of Washington, which is now going to be commonly referred to as the IHC, which is Immigration Health Coverage. And so basically what that means is that we had legislation passed in the state of Washington that identified that we want to offer preventative coverage and healthcare to any individual, regardless of their immigration status. So at this point in time, that legislation was passed. So we do have state-funded subsidies that will go into effect to cover a qualified health plan option. So as of November 1st of 2023, any individual, regardless of their current immigration status, is able to apply for a qualified health plan through the state of Washington. So it's very exciting news. We're very excited to have that. We don't have a lot of information about what that monthly premium looks like. So that's something that we're very open about in talks with the health benefit exchange, is that we're not sure if the current model with the health premium is going to be cost prohibitive to populations who are experiencing being undocumented. But it is a step forward for the state of Washington, so we are very encouraged for that. So it does allow individuals to access healthcare. They'll be able to purchase a health plan for their family under a $1 deductible, regardless of their immigration status. And that would be for enrollment period of November 1 for start date of coverage of January 1st of 2024. Next slide, please. So this is a state-funded program. So individuals are not going to be eligible for federal tax income subsidies. They're only going to be eligible for what Washington State refers to as a Cascade Care Savings Program. So individuals are able to qualify for a Cascade Care program if they meet or are below the 250% of the poverty line. So individuals who are able to enroll, I'm sorry, that's a typo, November 1st of 2023 to January 1st of, or January 15th of 2024 will qualify for that QHP option. So that qualified health plan. Again, to be completely transparent, we're not 100% sure what that monthly premium looks like. A lot of these final details are being ironed out right now. We actually don't even have marketing information released yet at this date and time. We're just sharing the information that we have available. What we do know is that when the legislators met in Washington, they initially approved this qualified health plan for enrollment of November 1st. And we continue to advocate for more coverage. So what happened is that we were able to secure additional funding for this program, and starting July 1st of 2024, Washington will offer a Medicaid look-like program. So they're calling it a Medicaid equivalent program, and those are for individuals who fall between that under the 138% poverty level. So that'll be more equivalent to a Washington Apple Health in compared to a qualified health plan. Again, this information comes with very limited detail that I have or am able to share. What we know right now is that individuals are going to be able to apply for that option July 1st of 2024. What we don't know is individuals who might have qualified for that and are currently in a qualified health plan that they enrolled in November, if it'll be transferable. These are details that we don't necessarily have ironed out, or that I have details to share, but as soon as I do, I share them with all my community-based organizations as soon as possible. Next slide, please. So the Cascade Care Plan, this is what Washington State is utilizing to decrease that monthly premium, since individuals will not qualify for a federal income tax. So the monthly premium, Washington State is going to utilize this Cascade Care Plan so that these are a feasible and reasonable monthly payment. And I know that they are working really closely to increase their funding in order to make these a feasible monthly payment. But at this point in time, you know, I've worked with this organization as a lead org for the last year and a half, and Cascade Care plans can range anywhere from $10 to $200 a month, which, as we know, with an annual out-of-pocket cost, is still pretty reasonable at the end of the day. So these are costs that might have a $200 monthly premium, but their annual out-of-pocket cost is only $6,000. So that means the individual is only experiencing that expenditure. So I know that the state is doing as much advocacy as they can to ensure that our populations who are experiencing being undocumented have lower monthly premiums to have access to healthcare. Next slide, please. So this goes on to what the Cascade Care Special Enrollment Period does. Because this is the new thing to Washington State, we offer this open enrollment period with a special enrollment period specifically for Cascade Care Health Plan. So if you meet all qualified health eligibility requirements and have a projected income of 250% below the federal poverty level, you can enroll in a QHP with Cascade Care at any time outside of open enrollment. So that's a unique option that we have. Next slide, please. So this is the material that I do have available for you today, Washington Apple Health videos for the immigration healthcare coverage. This is specifically done and distributed by the Washington Apple Health Benefit Exchange. And these videos were done in coordination with King County Public Health. And these videos were specifically done through the lens of individuals who have experienced being undocumented and the verbiage of what would specifically correlate through their lens of experiencing healthcare. So these are really great videos for you to utilize. They are accessible via this presentation, so you can share this afterwards. They're live on YouTube. As soon as I have more marketing available for the Washington Apple Health immigration healthcare coverage, I would love to share it, but at this point in time, this is as much access as I have to it outside of lead org meetings. Next slide, please. So in Washington State, you can access application assistance through WashingtonHealthPlanFinder.org, or as a lead org, we can assist you in all of my 7 counties, plus Pierce, Mason, Thurston, Snohomish, Whatcom, and Skagit. And you can utilize our 855 number. A unique part about CMAR is that we are a community health center throughout the state of Washington, but we do help any individual. So I have MOU contracts through Peace Health Southwest Washington. I recently established a new contract with Providence, Portland. So I'm specifically located in Clark County, and we utilize training and navigation to the healthcare system locally, not only through CMAR community health centers, but through the contracts that we oversee as a lead organization. So you can either find a navigator through Washington Health Plan Finder, you can utilize the 855 number, or you can come visit for in-person assistance at any of our CMAR locations within Clark County. So we have Salmon Creek, Vancouver, Delaware, East Vancouver, Fourth Plain, and then we also do have an Evergreen school-based clinic. And then in addition, that's only Clark County. In addition to my oversight as a regional coordinator, I also have clinics in Aberdeen, Elma, and Ocean Shores. And then we have various clinics throughout the mid-Washington, Seattle area, and upper north. So next slide, please. Any questions for me?
I have a comment if there are no questions, but I want questions first. Okay.
I think you get your comment, Susan.
I will jump in. So thanks for all that information, really, both to you and Erica. Lots of meaty stuff, and unfortunately, healthcare is so complicated, but just the reassurance that there's programs in both Oregon and Washington are expanding Medicaid and not contracting it. So hopefully people can get connected to care, and there are lots of good organizations that can help. The one point I just wanted to make is that, Kate, you specifically mentioned that what you do can't cover screening, but both states do have screening assistance. So just for people to be reassured that there are programs both in the state of Washington, in Southwest Washington, through Peace Health Southwest Medical Center, and in Oregon with the Oregon Health Authority, and then of course with Erica and her team at Northwest Family Services. But there are other federal dollars through the Centers for Disease Control that can help with breast, cervical, and colon health screening for people who might be and underinsured to go in and get back to those screenings. So if someone is then, those federal dollars can help with the whole workup. And then if someone actually is diagnosed with one of those cancers, that is when the health insurance programs can actually then start covering someone because there is a positive cancer diagnosis. So not perfectly seamless, but there are 2 programs that can help before and after a diagnosis, and just to reassure people that exists too, and we do want to encourage people to get into their screening.
Thank you, Susan. I think that's such a super important highlight, is that you are correct. There's several community-based organizations that are focused on being able to offer those resources to have that preventative screening, so that if a health crisis does occur, that we're able to step in. And yeah, we're so excited as the state of Washington to be able to expand on what Medicaid coverage we have, and to specifically work with populations who have not had the access that they deserve, and to be able to lower the barriers to their access and increase their access to healthcare overall. One thing I did not mention was, prior to this legislation being passed, CMAR was asked as a lead organization who is specifically rooted in a population that we serve that is undocumented. We participated in listening sessions. So specifically in Clark County, I held 8 listening sessions, and we had individuals who are experiencing various documentation, immigration statuses, and had a very open conversation of access and care. And what's really important and what we got from that was that it's the community-based organizations and their education of letting them know about these resources that provides them with the security of access. So it's about us talking. It's about organizations that are known within our communities that are experiencing being undocumented, the security of knowing that that information is coming from those people is really what the big message was. You know, like we heard over and over again, well, if we hear that CMAR's representing it, or like if we see it in CMAR, I'm going to know that it's safe. I'm going to know that this has, you know, been vetted, and I'm not going to have concern. And so the response was massive and supportive. And I just want to thank all of you, what you do in your community-based organizations to help our individuals feel safe and access healthcare.
Thank you so much, Kate. It was really helpful to hear from the Washington perspective and from the Oregon perspective. So I really appreciate both you and Erica. And yeah, so, and also I wanted to thank ScreenWise. Zuri's here, I noticed she joined us, who enabled the interpretation tonight. So thank you so much. For any of the guests on the call, any like final questions? We'll wrap up a little bit early, but this is a great opportunity to ask 2 experts any questions that you might have.
I would say I would just love it if anyone on the Oregon side wants to collaborate, because with the state of Washington, we're able to establish contracts with you. So you can actually do some screening to see if a Washington state resident qualifies for health insurance. Because we are a border community in Vancouver, it's not uncommon for a Clark County resident to be seen at an Oregon-based hospital. So if we have that contract, you'd be able to have access and be able to screen as well. So anybody who wants to take my contact information to have a further discussion with that, if we can close that gap, that's the most important thing.
I'm happy to get your contact information, send it to anyone that's attended along with the slides, if that's okay with you, Erica and Kate. I'll send all that out.
Yeah, thanks for that offer, Kate. It is
you.
a regional healthcare system. It does not stop at the Columbia River.
It does not, and we have that conversation a lot. I'm in a unique perspective. Most of my colleagues are, you know, mid-state, and I'm like, it's different. It's different here, right? Like most of our major health systems are in Portland, and we have individuals who don't always reside in Portland, but you know, so as we can do that cross-state collaboration, I would love that.
All right, so if there are no questions, and feel free to ask them via email too, you know, we can always get them sent over to the proper person. But yeah, thank you all for spending a little bit of your evening with us, and yeah, just have a wonderful rest of your evening.